Beautiful smile is the prettiest thing what you can wear. Hi, this is Dr. Vora from Dr. Vora's Dental Care, your smile specialist. Many patients ask me is, Doctor, is it going to be too much painful? Will my child be able to bear that much of pressure of wearing aligners and all? So let me tell you, Invisalign Aligner is the most comfortable aligner system in the world today. And 90% of my patients do not require any medicines or any restriction in diet when they are going through the whole process. There are 10% where the teeth are too much crooked, initially there is little pressure on the teeth for 1 or 2 days. They might require some change in the diet, in the sense you have to avoid some roti and all, have some dal rice, khichdi, shira, idli, poha, upma, milkshake, juices for just 1 or 2 days. Once you feel now pressure is less, your teeth are okay, you go back to your normal diet. As such, there is no restriction from my end, but sometimes patients are not comfortable, the teeth are little sore, they can use some soft diet for 1 or 2 days. Also, if you feel the pressure is more, it is giving you some headaches because of the pressure, usually that scenario is not, I have come across too often, but suppose if you feel so, there are some over-the-counter pain relief medicines available like Flexon, which contains ibuprofen. So for kids you can take half a tablet of Flexon, or adults can take a full tablet 1 or 2 times a day for 1 or 2 days. As soon as you feel now you are okay, you can stop that medicine. Sometimes it also helps if the teeth are a little sore, just put a pinch of salt in a lukewarm water and hold it in your mouth for 20-30 seconds. So that will just make the teeth little easy and comfortable. Also, a lot of patients, especially the parents, have that query, Doctor, is it really going to work? Just a small piece of plastic, does it have that much capacity to move the teeth to such a nice alignment without the use of braces? So let me tell you, Invisalign is in US since almost 2005-6 onwards. So it's been almost 15-20 years that Invisalign is there in the market. In India, it was available since last 2017-18, and we have seen thousands of patients getting very well treated, good smile, balanced bite, and beautiful alignment with this Invisalign system. And there is, I have seen a lot of nice smile enhancement happening, and it's a really very comfortable and an easy way to get that perfect smile. A lot of parents also ask me, is my child going to wear it? Because it's a removable, suppose if he is not wearing it, and how will it act then? So till now I have seen, since it is a very comfortable, easy, convenient appliance, none of the child not wearing it. However, saying that the child needs constant motivation, and once they see the results happening, the teeth aligning, it becomes also encouraging for them to use the appliance. Unlike braces where there are a lot of rashes, lot of food getting stuck, difficult to brush, and some eating care what you have to follow. That way, Invisalign Aligners is very simple. You can enjoy all kind of food, there is no restriction. You can brush well, there are no hygiene issues. So when you compare the two systems, the braces versus Invisalign Aligners, the child acceptance is very well, and I have not seen any child not wearing it because it is uncomfortable. Yeah, if it because of the laziness and they don't like to wear it and remove it, so we need to encourage child and motivate them. Another question which majority of the patient has is, I am traveling and I cannot come very often, so still am I a good candidate for any Invisalign or aligner treatment? So let me tell you, aligners are best for the people who have lots of traveling to do, because we do not require to see patient that often, and whole treatment is pre-planned before, and the whole set of aligners are available. So patient, if they have a planned visit, they can inform us, so we can give those many sets of aligners for those weeks or months, and the treatment continues without them having to personally come and see every month like braces. We need to tighten every month, do some adjustments, whereas aligners are pre-programmed to move the teeth in a desired direction. Many times I don't see patient for 8 months, 9 months, and still the treatment goes on according to the plan, I just monitor them virtually. There is an option or virtual care in your Invisalign app. So they just keep on sending me those pictures. I monitor them. I ask them to make those changes or how to wear the aligner, elastics and all those, and the treatment continues. And this was especially helpful during the COVID time, when it was very difficult for many of the patients to step out of the house and come to visit doctors. So patients who were on braces were finding it really difficult to, if they have some broken braces and some difficulty, and they cannot be with a broken wire and all for a long, and they have to visit a dentist. Whereas in Invisalign patients, they were very comfortable, no emergencies. The treatment went on continuously for months together without any interruption. Also, some of the patients have that query, is it going to affect my speech? So yeah, some of the patients do find it difficult to speak, especially the words like S, Z, T, where our tongue touches the teeth, and the tongue has a different feeling now because of the aligner. But it's just a minor problem, and in 1 or 2 days you just go home, read anything loudly for 1 or 2 hours a day, and your tongue will become free and get used to the new aligner, and then the whole treatment, there is no issues with the speech or anything.
Invisalign is comfort and confidence, so you can have the smile you want the way you want it. Invisalign, transforming smiles, changing lives.